most of the patients that I have that are diabetic, that have dental issues, end up getting dental implants because of that. But Dr. Brown,
if you are being treated and if your numbers are right, yes, implants are safe. I would really go to an oral surgeon rather than a general dentist for implants if you have diabetes. I work with a gentleman who I've never seen anybody place an implant so fast. He did an implant like I did a filling, but there was a patient there, and we tried to put a crown on his implant, but he didn't take his medicines correctly, and his numbers way off, and so his diabetes was
uncontrolled.
And so his implant did not work. It was loose. So the implant is based on the fact that you can put this titanium device in the gum, close it up, wait about 4 to 6 months, and some wait less than that. And then the bone will grow against the implant. And then implants done correctly, that's like rebar in concrete. I mean, they ain't gonna move. You can move an implant, but it ain't gonna shake.
Stronger than your regular teeth. Yeah, okay, so to answer the question is, Deborah Bell, if your diabetes is well controlled and you have a normalized hemoglobin A1C, meaning less than 7, and your diabetes is well controlled, you will have a better outcome and a better outlook than if your diabetes is questionable or if you're not taking good care of the blood sugar. So again, a partnership between you, your diabetes caretaker, your primary care doctor, your internist, your endocrinologist, and your dentist. Y'all should all be working together to optimize your health, one, to make you a better dental candidate for an implant, and then do the implant. So you just brought up a good point, Dr. Brown, because I've heard both ways. I've heard people get the root or the base of the implant placed, and then it has to set and bone has to grow in it for months. But then I see advertisement for 1-day dental implants. You come in, you get your MRI, you get implants, you get all that stuff in 1 day. How does that happen?
I don't know.
Not recommended.
They have good malpractice insurance.
Okay.
And I'll say this: anytime anybody gets an implant, you have to have a full blood workup. You have to. There's no variation from that. They take your blood pressure, say you're good to go. We're going to do the implant. No, you need a full workup because they have to check your general health. Because implants are nothing to joke about, because you're putting in an artificial, a man-made device. Into your bone, and you're looking for what we call osseointegration. In other words, the bone is going to grow against the tooth. Teeth are connected to bone by microscopic fibers called periodontal ligaments. I'm not trying to get you scientific, but anyway, you can shake every one of your teeth. You can shake it a little bit, maybe 0.5 millimeter or so. But an implant, where it goes, you go. Okay, so that's the difference.